Well, our guest, Dr. Kevin Kavanaugh, is a retired physician. He is also founder of a national organization called Health Watch USA, and Health Watch USA had their big conference yesterday. Dr. K, good morning.
Good morning, Jack.
Tell us about the conference and how it went.
Well, it went very well. We had a large turnout. Of course, we had some authorities from around the nation and around the world talking about what their experiences are with the COVID-19 pandemic. And I tell you, anybody who thinks that this is some made-up hoax and some conspiracy should listen to these guys. All of these countries are struggling. And how well the country has done largely depends on how well they followed public health advice and how well the population really joined together to fight the virus. And it was really something. Countries use strategies such as masks, social distancing. In England, in areas where they're affected by the new variant, for example, the Delta variant, they're testing everybody. I mean, everybody twice a week. And so it's quite different. One of the things I found interesting was Spain is very much in the situation that we're in. They're a federated nation with independent states, and each state kind of does their own thing. And they have a large movement of freedom, where our rights of individuals are greater than the virus. We're not going to do much of this. And that's inhibited their pandemic response. I think they've even elected an official now that is, represents that movement. But the anti-vax movement in Spain is quite low. So in that regards, they're ahead of us. The rest of Europe is kind of, I think, flipped on that. They've got a much larger anti-vax movement, but they tend to follow scientific advice. Australia is probably the best example of how you should do things. They're also a federated nation, but early on they formed a scientific committee that they chose to run the nation and the virus. In other words, run the virus out of the nation. And that was quite an interesting thing because here they actually formed a federal bureaucracy composed of scientists to guide the nation through the pandemic. Singapore also did well. They're an island nation. Both of those nations use apps to track people and to register where you are to augment their case tracking. And if you looked at deaths, and believe me, both of those nations have very good public health services and case tracking, and they count deaths. They have a robust public health system. And if you look at deaths, if we did as well as Australia, adjusted for population, we would have under 12,000 deaths total in our nation. If we did as well as Singapore, we'd have under 2,000 deaths. I mean, they're small. Australia, country of 25 million, 910 deaths. Singapore, 6 million people, 34 deaths. So it's really some lessons to be learned, and we're not out of this yet. And the only reason why we're not out of this yet is people aren't getting vaccinated. We should be, even with the Delta variant. And I think that this is probably the last major variant that we're going to be seeing because it has that E484, I guess it's a Q instead of a K mutation. I think the virus has kind of peaked at that, or at least reached a fitness plateau. But even with that, the vaccines work. But if we don't take advantage of them, we may be in for another wave. That's all up to us. And so that's kind of distressing. And the other big topic is that this thing is airborne. We really do need to change the way we live, start doing things to make our air as safe as we do for water and surfaces, and really try to drive down these pathogens because we don't want to be caught with our pants down like we did during this pandemic with the next one. And the next one will occur. Believe me. I mean, the stuff I'm reading in the literature, when they talk about gain of function research, but believe me, Jack, that's not some, bioweapon. These guys are doing that stuff on everything. I read an article on how they could make the flu virus more deadly. The avian flu virus, if you adjust this with the seasonal flu virus, you get something that would infect people and kill 60% of them. And then they published how to do it in a journal. It's kind of like publishing how to make an atomic bomb. So we really do need to change, and hopefully that will happen.
Dr. Kevin Kavanaugh, thank you so much.
All right.